Greetings everyone, this is Chipo a student from CBU, presenting the e-poster with the topic investigating the prevalence and determinants of active syphilis infection among pregnant women testing active on syphilis, RDT at antenatal booking using titration in Kalabo district. So the importance of this study, the findings who add to improving diagnostic accuracy, guiding targeted interventions and optimizing management strategies. This study will enhance public health efforts in syphilis control by addressing gaps in current antenatal care screening practices and reducing adverse effects of pregnancy outcomes linked to untreated infection. Syphilis is sexually transmitted and caused by Bacterium Treponema pallidum. Despite it being preventable and treated, syphilis still remains one of the significant public health concerns, as syphilis causes maternal syphilis causes neonatal death, fetal loss, stillbirths, and preterm. In Africa, syphilis accounts to about 57% of the global burden, according to Lendando 2022. And the studies conducted in Zambia shows that syphilis serial prevalence ranges from 5.6 to 12.5% in pregnant women receiving antenatal care. This is according to Jones et al. 2022. The aim of this study is to estimate the prevalence of active syphilis infection among pregnant women testing active on standard RDT at first antenatal care using titration method. The primary objective is to investigate the prevalence and determinants of active syphilis infection among pregnant women testing reactive on syphilis RDT at first antenatal care using the standard Q. And then our specific objectives are to determine the prevalence of active syphilis infection among pregnant women attending first antenatal care in Kalabo district, and then to identify the social, demographic, and clinical factors associated with active syphilis infection in pregnant women, and then to assess the relationship between active attendance and the risk of active syphilis infection. So, this study will employ a cross-section epidemiological design to assess the prevalence associated factors with early syphilis infection in Kalabo district. And then the inclusion criteria will be patients or clients of all ages and sex in Kalabo that test reactive with standard Q syphilis RDT. These will be considered. Then the exclusion criteria will be patients or clients with incomplete medical records. Samples that test non-reactive with standard Q syphilis RDT will be excluded from the study. Blood samples received in the laboratory for syphilis test shall be tested using standard Q syphilis RDT. The active tests will be included in the study for further testing using RPR titer test. Results of the two tests will be compared to determine if they agree or not, and specificity for their sensitivity will be documented. For the study, we will also use the ethical consideration to conduct this study. The ethical clearance will be requested from CBU, Ethics Committee. Permission for further tests will be obtained from YDHL management and also from Kalabo district office. The data from questionnaires and laboratory tests will be coded in Excel, cleaned and analyzed using starter version 14. Descriptive statistics will be used to present the data in form of frequencies. With the chi-square test, official exact test will be used to compare the proportions of early syphilis in category variables. And then the logistical regression analysis at 95% confidence interval and significance level of 0.05 will be used. Thank you.